Daniel?
I represent the American Cancer Society, and 2/3 of cancers, most people don't know this, are actually preventable. We have 560,000 Americans who die every year from cancer. And if we simply, 1/3 of them are tobacco related, so if we had aggressive tobacco policy, which we've had, and thank you to the President for signing the 62-cent increase as part of the S-chip bill, but also obesity is a growing problem, and the linkage with cancer is now very strong, so we need to address that. And from the prevention side, we believe transforming, if we simply change the payment, we just have payment reform, we're not really going to change the system. We actually have to put prevention into the system from the beginning. And so we actually do need to change how we incentivize prevention at the basic level to family care docs and others who are out there, and in the community setting and other places like that. That's absolutely critical as we go forward. So I think building prevention in from the beginning is absolutely essential to actually then getting to the cost issue, because if you actually keep people healthy, and then you can also manage in cancer, if you find it early, detect it early, you have lower costs up front, and you actually can manage the disease, and people will actually live longer. So there are huge gains from a quality of life perspective for people as well. The second thing I would say is we have what we call our 4 A's on coverage, which is we believe it should be available, affordable, adequate, and administratively simple. And I want to address the adequacy piece of that, because I think many people are talking about availability, but it's not enough if you just have an insurance policy. We just did a report which we released with Kaiser about 3 weeks ago that shows how many Americans are falling through who are insured. We have 25 million Americans who actually, through co-pays, with monthly limits, annual limits, lifetime limits on their policies, are quickly finding that they actually don't have adequate coverage. So I think as we establish some goals for middle-class America, we need to make sure that we're actually protecting average citizens from not falling into bankruptcy because of a cancer diagnosis or any other severe kind of disease diagnosis. So I think that's really, really important. And I think setting some kind of a cap about what those out-of-pocket costs are going to be for everybody so that nobody ends up in bankruptcy. A medical, a diagnosis of cancer or any other serious disease should not equal bankruptcy.
We'd like to pose the question to the group. We talked a lot about access and ways to expand it, and the importance of it, the responsibility that people have to participate in the system. I'm curious on the financing question. It's a tricky question. How do you think about financing as kind of from where each of you sit? What are the best ways to pay for this?
Well, this won't pay for all of it, but it's a piece that does two things, which is you just increased the tobacco tax by 62 cents. And 5 years ago, President Bush's Health and Human Services Department actually made a recommendation that the federal tax should actually go up $2. That actually raises substantial revenue, and it has the extra effect of actually driving down long-term health care costs, because for every increase of 10% in the price, you get a 7% decline of usage among kids and a 4% among adults. And we now have the lowest smoking rate in the country since right after the end of World War I, because we've had aggressive public policy in the last 20 to 30 years to make smoke-free environments and to raise the price. We can further drive those numbers down and get to a point where we actually have much lower levels of people smoking, and you can raise some of the revenue from that particular revenue source. So that's one particular way that you could do it. Just a couple of quick points, and I don't want to get off your point, but just a couple things I wanted to say that were important, following up on Senator Hatch's comments. Research is absolutely critical, and I think we need to look at this from a broader perspective. Rather than just fixing the healthcare system, we need to think about the research that we need to do to actually continue to innovate. Evidence-based medicine is absolutely essential. We're very vigorous supporters of that. We need to balance that with the need to innovate, so we need to actually promote clinical trials to allow that to go forward. Our chief medical officer likes to say we're not for rationing care, but we're for rational care. We actually spend twice as much money as any developed country on the care we give per capita, and yet we have the 37th we're 37th in life expectancy around the world. We're not spending the money well right now, and we need to actually get to evidence-based medicine. The other topic I would put on the table about costs that you would raise, Melody, and it's one that I don't know is a government solution, but I think it's important to have a discussion in this country about end-of-life care. We as a country spend a tremendous amount of money at end-of-life, and we should give Americans the ability to choose the course. But in order to do that, and they should be able to have the freedom to choose whatever course they want, but they need to be educated and providers need to be educated, and we need to do a much better job of helping to educate people about their choices at end of life, and that could actually bring costs down in the long run if you do it smartly. So I wanted to raise that, and just, your financing question, one piece is the tobacco tax. It's not the only piece, but it's one piece.